Hi, my name is Gregory Kuzmik. I'm a neurosurgeon at the Ayer Neuroscience Institute at Midstate Medical Center. I specialize in spinal surgery and see patients with degenerative conditions of the spine. My grandfather was a physician, and I heard stories about how people in his community came to him for help. So that's something that I really admired. And I think that really influenced me to take this career path. So I chose to go into neurosurgery because it's such an exciting and innovative field. We're constantly learning new things about how the brain and the spinal cord work, and we're able to bring cutting-edge technologies into the operating room to help us treat patients with conditions of the central nervous system. My fundamental philosophy of care is to treat every patient as if they were a family member of mine. So what that means is I only recommend surgery when it's necessary. And when I do perform surgery, I perform the least invasive surgery that I can. Oftentimes that means I'm able to use minimally invasive techniques to minimize a patient's post-operative discomfort and speed up their recovery. When I see patients in the office and they come to me for a surgical evaluation, there are three kind of important components that I want to go through with them. Number one is to get a good understanding of what their symptoms are and where they're experiencing their symptoms. Number two is doing a physical exam and seeing what physical exam findings they may have that correlate with their symptoms. And then the third component is to review a patient's imaging studies, so an MRI or a CAT scan, for example, to see if the pathology that I can identify on the imaging studies correlate with their symptoms. And when all those things align, that's when we can be confident that we can treat that condition and get a good surgical result. There's no better feeling than going to the recovery room and seeing a patient after surgery and having them tell me that their arm pain or their leg pain that's been so debilitating for them is totally gone. It's really about giving people their lives back. We are extremely fortunate that at Midstate Medical Center, we do have a great team with us in the operating room, from the OR nurses to the anesthetists, to the physical therapists that see the patients after their surgery, and all of that contributes to a successful outcome for us. I think it'd be important for referring providers to know that I do fall on the conservative end of the spectrum when making recommendations for surgical treatment. Outside of medicine, I enjoy getting outside and exercising. I like riding my bike when it's nice weather and skiing when there's snow on the ground.